Well, we have hit 11 o'clock, so we can get started. Welcome to all of those who have joined us today. We are so excited to have BreeAnn Silcox from our Salt Lake County Health Department today to talk about mental health and safe messaging surrounding it. So BreeAnn is actually the suicide prevention coordinator over at Community Health. And BreeAnn, I'm just going to turn it over to you to tell the people what you do on a daily basis and how they can use you as a resource.
Perfect. Thanks, Sadie. So, like she said, my name's BreeAnn Silcox, and I work as a suicide prevention coordinator at the health department. So, a lot of what my program works on is focusing on risk and protective factors related to suicide prevention. So, we do a lot with promoting connectedness and coping strategies and looking at reducing access to lethal means. And then promoting help seeking skills. So we do lots of trainings. Sadie's been doing the QPR trainings with Healthy Lifestyles. We also do that through my program as well. So if anyone's interested in learning more or wants more resources, please feel free to reach out to me. I'll have my contact information at the end of the presentation. So Sadie, do you want me to just go ahead and jump in?
Yeah, let's jump in. I'll share the sign-in link in the chat box.
Perfect. Okay, so today we're going to talk about safe messaging related to suicide prevention. So, the way that we talk about suicide and the way that we message about suicide is going to be important in helping us to reduce stigma and helping us to help people who are having thoughts of suicide to have safer interactions with media and with us as we, verbally talk about suicide. So, just kind of to start, I know that suicide can be kind of a hard topic to discuss, and we're going to show some images today that they're not graphic, but they may be a little bit triggering if you've experienced suicidal ideation or know somebody close to you that has. So, if at any point you are feeling a little bit overwhelmed, please feel free to reach out to me or Sadie afterwards and we can get you connected to resources. But then just kind of keep these things in mind as well. Just take a minute to kind of relax and breathe, and maybe go outside if at any point this is a little bit overwhelming. So I'm going to show you some images and we're going to kind of talk about those. There's going to be two different sets. So I'm going to go through the first set and we'll kind of talk about it and then I'll go through the next set. So we want to look at suicide and identify if the story that we're sharing is hurtful or helpful. So I'm going to go ahead and show you these images now. I'm just going to kind of scroll through them and then I want you to put in the chat how these images make you feel or what words kind of come to mind when you see them. So how do those make you feel? You can throw in the chat. Someone says no hope and anguish. Yeah. Any other thoughts? I know for me, they feel very isolating. We see kind of some of these images where people are maybe, surrounded by people, but seemingly alone. They show a lot of despair. And so that's not how we want to message around suicide prevention. We want people to feel hopeful when we message about that. And so I'm going to show the next few kind of slides, and then we can kind of talk about how these images make us feel. So how do those kind of messages feel? Does anyone have any thoughts? Chat. Connected? Yeah. Hopeful. Thank you. Yeah, they show a lot more. Oh, a little generic though. Yeah. Yeah, they could maybe be a little bit more specific, and that's maybe where we would look at the population that we're messaging to and maybe make those a little more tailored. But we definitely can feel in these images that there's a lot more hope, connection, people reaching out, doing that help seeking. And so that's again what we kind of want to convey with our messaging. We want people to feel like there are resources and that there's help and hope. So, safe messaging is communicating about suicide in a manner that's proven to reduce risk for vulnerable individuals already at risk of suicide. And then also to look at increasing knowledge, attitudes, and behaviors that are protective from suicide in all community members. So I kind of mentioned at the beginning how that's part of my job is I help promote connectedness and coping strategies, help seeking, those are all the things that are going to be protective. And so those are things that we want to be emphasizing and helping people to, recognize and work towards that in our suicide prevention efforts. So what we say and how we say it matters, and the images that we use can either increase risk among individuals or can promote resiliency, encourage help seeking, and encourage actions that help prevent suicide. So it's important to keep in mind that there are two audiences that we are messaging to. So there's kind of the general public who may have some misperceptions or, stigma around suicide, and we want to help kind of break those misconceptions and help alleviate some of that stigma. But then we are also messaging to those who are at risk. And so we want to, again, inspire hope and help seeking for those that may be at risk and maybe having thoughts of suicide. So providing resources and education on how to get that help. So messaging really is important. There's been over 100 studies that show that certain types of news coverage can increase the likelihood of suicide. So they looked at celebrities. So when a celebrity has died by suicide, kind of how that has been messaged, looking at copycats. So for instance, if somebody identifies with a certain celebrity that dies by suicide, it may make them more likely to, you know, make a suicide attempt. So there was a reference group that they talked with, and one person talked about Marilyn Monroe, and they said, with all the fame and fortune, and she couldn't endure life, why should I? And so we want to make sure that when a celebrity dies by suicide, that if we see things on Facebook or Instagram that doesn't convey this safe messaging, that we are not sharing those things, because that could be putting others at risk. So again, if someone that's a celebrity or kind of a politician or someone that's well known dies, we want to be sharing resources and education and promoting that help seeking. These studies also looked at real life versus fictional and recognized that they're 4 times more likely to be copycats with real life than fictional. So that's again something to kind of keep in mind. And then also the medium. So something that is in print can be shared over and over and over again and reread, where TV may be kind of like a quick 10-second, little blurb that might not be as easy to kind of see again. So just important to kind of keep these things in mind about why messaging matters, that there's been some research done on this about how these different types of news coverage and the duration and the amount of coverage can affect those who are at risk. So looking at a framework for successful messaging, these are kind of the guidelines that we want to keep in mind. So the strategy, making sure that our messaging is planned and focused so that our messages can be effective. Ensuring that we have a positive narrative, so providing actions, solutions, successes, and resources. So this is where we could be sharing people who have maybe had suicidal ideation and what they did to be able to overcome that. Our guidelines, making sure that we're following best practices so that we are following all the things that we're talking about today. And then making sure that our images and our language promote safety so that we're not undermining that prevention message. So messages that are unsafe. I'm going to pull these up. So kind of repeated, prominent, or sensational coverage. So that could include, you know, graphic information, details about suicide method or location. We do not need to include that. If someone is reporting on a suicide, we don't want the location or method included. Again, that's just going to put people who are struggling, who maybe identify with that type of person, at higher risk. Glamorizing or romanticizing suicide. So this we can see in like Romeo and Juliet. There's kind of this romantic idea behind, you know, them kind of dying together, and we don't want to promote that message. Portraying suicide as a common or acceptable response to adversity. You know, lots of people have had thoughts of suicide, but most people do not die by suicide. And so, again, we want to be promoting that help seeking and that hopefulness that most people are going to go on to recover and live happy, healthy lives. Presenting simplistic explanations, so that could be tying a suicide death to one thing, saying, you know, because somebody experienced a breakup, they made an attempt, where we know that suicide is really complex, and most of the time there's multiple factors going into why somebody may be having thoughts of suicide. Including personal details that encourage identification. We've kind of talked a little bit about that, how, you know, if we kind of see ourselves in somebody who's died by suicide, that can be a risk for us. And then negative stereotypes of people with mental illness. So oftentimes we hear, you know, especially after there's maybe been some things that have happened in the news, we hear a lot about people talking about mental health and violence, but in fact, most people who experience mental health are more likely to be a victim of violence than a perpetrator. And so we just want to make sure that we're not reinforcing negative stereotypes or saying things about people who experience mental illnesses that reinforces that stigma. So looking at kind of some examples that we've seen in messaging, after Robin Williams died by suicide, there was kind of two sides of the messaging here. There was a 50% increase in calls to the National Suicide Prevention Lifeline a week after he died. So that's positive that people were reaching out, getting help. But unfortunately, there was also a 10% increase in the number of suicides in the US within 5 months after his death. Men ages 30 to 44, that was increased by 13%, and the same method increased by 32.3%. So, you know, you can kind of see how people may be identified with around the same age. And then when the method was talked about, that increased as well. And so again, we can definitely report on someone who's died. We can share messages of someone who's died by suicide, but we want to make sure that we're focusing on that hopeful aspect, that we're encouraging people that if they are struggling, that they're reaching out and getting help. So what are those messages that are helpful that we want to focus on? Number one, suicide is preventable. So we know that there are steps that we can take to help somebody get access to help. So this is not to minimize anybody who's lost someone to suicide or place blame on anybody. We know that we can do what we can with the knowledge that we have at the time. And, you know, when we've lost someone to suicide, it can sometimes feel hurtful, or can you know, be grief for us of feeling like, oh, you know, I wish I would have done A, B, or C. I wish I would have seen this or that. But just keeping in mind that, you know, moving forward, we can maybe see those warning signs or, you know, take some different actions. But, you know, most of us would step in and do something if we knew. So that suicide is preventable. It's important that we message that, but also keeping in mind that people have lost somebody, that it's never anyone's fault when we've lost someone to suicide. Sharing lived experiences from those who have overcome suicidal crisis. So making sure that those are safe, that that person has worked through that, that they're at least a year out from their kind of crisis situation, that they're able to speak to that in a safe way. Education on warning signs and means restriction, making sure that people are aware of what to look out for, and then making the environment safe. and then also resources so that people can find treatment and kind of promote that help seeking that we've talked about. So again, let's see. I kind of said this before, but suicide has multiple causes and most people are going to display warning signs. So you can kind of see our warning signs here that are mentioned talk. So those are going to be statements of hopelessness, someone talking about not having a reason to live or feeling like they're a burden to others. Maybe they're in unbearable pain. Their moods may be different. So paying attention to, kind of those depression, anxiety, irritability, those indications that someone may be struggling. Their behaviors. So maybe they're taking more risks than normal. Maybe they've had a sudden interest or disinterest in religion, or they're giving away things that they care about. So just kind of paying attention to those warning signs. And then also recognizing what is going on in their life that could be difficult as well. So, what situations are they experiencing that could be hard for them? So asking about thoughts of suicide, it can feel scary, but that is going to be important for us to be able to identify if someone is having those thoughts and be able to help get them connected to help. And, I kind of mentioned the QPR trainings that Healthy Lifestyle is doing, but that is a great way to learn how to ask about suicide and then how to get someone connected to help. Sorry, my thing is not moving forward. There we go. Also talking about how seeking help is a sign of strength, right? So sometimes we may have these ideas or, you know, community kind of cultures where seeking help might not be the norm. But we want to, promote that message that that really is a sign of strength and that that is going to be a helpful move in helping them get over their or kind of work through what they're experiencing. Suicide's not a natural or logical outcome of adversity. We've kind of talked about that already, but had thoughts of suicide or even if they've made an attempt. So 90% of people who've attempted suicide and survived do not go on to die by suicide. Treatment works. A lot of times I hear people say, I saw a therapist one time and it was a terrible experience, so therapy is not for me. But we like to kind of compare this to the haircut analogy, right? If I were to go get my haircut and they did a terrible job, I wouldn't say haircuts aren't for me. I would just say that person was not the haircut person for me, right? And I would just find someone else. And it's the same thing when we're trying to access treatment. We might not always find somebody the first, time we reach out that is a perfect fit, but we just need to keep trying and see if we can shift that and find someone else that can help. Other messages, you're not alone. Helping people feel that connectedness, that's going to be important. And then positive social norms. Again, we've talked about this a few times, but most people go on to recover. So creating that positive narrative in the 34-day period following this song's release. So you maybe have heard this by Logic. Calls directed to the Lifeline rose by 6.9%. So again, in that song, it says, I want you to be alive. I want you to be alive. You don't got to die today. And so we saw an increase in people accessing help. So that's really positive. And then suicide deaths decreased by 5.5%. So we can see how those positive messages can help, with our suicide prevention efforts. Looking at Utah, we've seen how suicide attempt survivors can share stories of recovery after a crisis and how that can be beneficial. If we want people to not identify with someone who's died by suicide, but we can create that identification with someone who's recovered, right? And so we might see somebody who's experienced some similar things as us and see how they've been able to overcome that. That can be helpful in us learning how to access help. And then the language that we use matters. So just kind of in a general sense, when we hear the word successful or completed, when we're just talking about life, that is usually tied to a positive thing. We've accomplished a goal or we've, achieved something we've been working towards. So instead of saying someone had a successful suicide or they completed suicide, we'd want to say they took their life, died by suicide, died as a result of self-inflicted injury, chose to kill him or herself. Um, so this kind of indicates that somebody would maybe was in a state of mind where they had that logical part of their brain functioning at full capacity and that they had that ability to kind of make a choice. And so again, a lot of times when somebody is at that place, they're not necessarily thinking clearly. So you want to use those other phrases. And then committed suicide. So oftentimes when we hear the word committed, it's followed by someone committing a crime or someone committing a sin. And we don't want to tie that to suicide. So we just want to think about it in the same way that we would think about other deaths as well. So we wouldn't say that someone committed cancer. So instead, we'd just say died by suicide, took their life, died as a result of self-inflicted injury. Looking at our tone is going to be important as well. So making sure that we're using correct terminology and up-to-date information. So a lot of times when I hear, if I'm in a conference and I hear someone say committed suicide, or some of those other terms that we just talked about, to me that kind of reduces that credibility because that's not using that correct terminology. So as much as we can, just trying to use that up-to-date information is going to be helpful. Empathy, we want our messaging to show empathy and understanding that there's no judgment. Just because someone's had thoughts of suicide does not mean that there's anything wrong with them. We don't, of course, want them to act on those thoughts, but it doesn't mean that they're weak or that anything is wrong with them. Warmth, so person-centered language that focuses on individual experience in an emotionally comforting manner. So instead of saying, she's bipolar, you'd say she's living with a mental health condition or she lives with bipolar disorder. So using that person first language. And then inclusivity. So mental health is part of all of us. It's kind of that part of our shared humanity. So use language that conveys openness, community, and inclusivity. And then we want to have a call to action to our audience. So it's of course important to know about the problem, but we want people to do something, right? And so we want to have a call to action, whether that's, reach out to a friend that you think may be struggling, or call the Lifeline number, or put 988 in your phone, whatever that call to action may be. We want to make sure to include that. So just to clarify, the suicide prevention lifeline number, that was 1-800-273-8255, that has now shifted to 988. So you can call that 3-digit number and be connected to the crisis line. So just want to let you know that that is a great resource that has since July been in effect. And then we want to look at the different types of communications that can impact public perception of suicide in either helpful or unhelpful ways. So we're going to kind of go through some of these different categories. So looking at public health messaging, postvention, news reporting, data communications, and then stories. And just keep in mind, we want to make sure that we're contributing to that collective narrative of hope and resilience and not despair. So data communications, it's important that we gather data, right? It informs our prevention practices, but we don't want to use data to cause alarm to the public or normalize suicide behavior. So in our QPR trainings, we usually share a slide that looks something like this. This shows kind of that the Intermountain West region has some of the higher rates of suicide deaths. We've actually dropped from 10 to 11, so that's positive. We're making progress, but this can kind of help us, talk about some of the things of what may be contributing factors to that. So we have lots of rural areas in these communities where access to mental health services may be a little more difficult. We also have high gun ownership. And so knowing this can help us take some actions that may help keep our communities safer. But again, we don't want to just always be focused on the data. And then looking at suicide as a lifespan issue as well. So a lot of times we hear that youth have the highest rates of suicide death, but they actually make up about 6% of deaths in Utah. Definitely a concern, definitely something that we are working on. But we want to make sure that we understand that some of these other populations may have different levels of risk as well. So we see more deaths in our adult male population than in our females. And then we also, there's limitations in data, and we need to recognize that as well. So this just shows male and female. This does not include information about those who are non-binary or identify as transgender, or, you know, maybe their gender doesn't fit into this male and female. So we definitely see those kind of limitations as well. Data, again, can be important because it can help correct misperceptions. So looking at the data, this can sometimes surprise communities. Sometimes I hear people say like, oh, that's a group that I would have never thought about, or I was surprised about this. And so it can maybe help us take action in different ways or look out for people that we maybe wouldn't have necessarily thought could have been at higher risk. And then we want to keep in mind again that when we share data, that we also share that there's hope and help. So this is a great quote that we also share in our QPR trainings. It says the corollary, more positive statistic, the one that is not articulated often enough, is that among all those millions who actively consider suicide, less than 1 in every 10 make an attempt on their own lives. And of those, only a minority ever go on to die by suicide. This means that in every community in the country, in every part of the world, we're living among people who have faced the worst of personal pain and doubt and have come through them to better lives. Why is there so little in the public sphere about their trials, triumphs, and truths? So again, we want to make sure that we're following up that data with these hopeful messages of, you know, lots of people have maybe thought about it, but most people recover. Looking at news reportings. So this is something that we maybe want to, maybe we ourselves are not reporting on a news station or in print, right? But we may be sharing these messages on social media. So it's important to know what are safe messages that we can share. So reporting suicide as a public health issue, including resources and using appropriate languages or appropriate language, emphasizing help and hope, and then asking people who work in suicide prevention. So having quotes and information from people that do this kind of every day. This is something that we often see people reaching out to the county or to, you know, the Utah Department of Health and Human Services to get quotes and information about that. And that's a great reporting practice. Or to include a sidebar with warning signs of suicide and what to do about those warning signs. And then there's lots of resources on how to report about suicide. There's national recommendations. So if you at some point are reporting for some reason, you can definitely delve into some of this a little bit more. But just keeping this in mind when we do see those articles or those videos, that we want to make sure we're sharing ones that are safe. So postvention communication. Postvention is when we are responding after we've lost someone to suicide. So there's definitely going to be kind of some added complexity. Oops, sorry. When we've lost someone to suicide. So just making sure that those who are close to the person are not feeling like they are feeling blamed, but there can be kind of some heightened risk of suicide after we've lost someone. We want to make sure that we're responding to all sudden deaths the same way. So again, this kind of can go along with that glamorizing suicide. So if we were to have a suicide death and do a big, huge thing for that, but we wouldn't do that for somebody who died in a car crash, that could be something that would maybe put others at risk. So we want to make sure we're responding to deaths all in the same way. So if there's been a car crash and someone's passed away and we want to take a casserole to that family, we would do the same if somebody died by suicide. And we want to look at this in kind of like communities and within schools as well, within work sites, making sure that people have access to resources, reaching out with compassion and concern to the family. Oftentimes when someone dies by suicide, family members can feel like no one said anything, or no one, you know, has asked them how they were doing, or things like that. And so it can be hard to know what to say, but just keep in mind that we just want to show compassion and care, and that we're sorry for the loss and that we're going to be there to support the person. And then providing mental health professionals on site or sharing contact information widely. So that could be if we've maybe lost somebody in a work site, that could be having a mental health professional come and they're in the break room for a day or two to provide kind of some resources for those staff that were left behind. Also, just looking at working with loss survivors and public information officers, just making sure that we're developing messages for institutions like schools, workplace, churches, that we want to make sure that we're providing that information that's going to be, again, safe messaging. Crafting messages to dispel rumors and share a message with correct information, warning signs, and where to access mental health care. So there is a whole postvention plan on the Live On Utah website where if you have lost someone to suicide in your community, you can kind of work through that postvention plan to make sure messaging is safe and that people are getting access to help. And then I can send these resources to Sadie, and then looking at our public health messaging. So Live On Utah is Utah Suicide Prevention Campaign. So tons and tons of resources available on this website. I would definitely suggest you check it out. There's information about how to help somebody, how to get help yourself, if you want to take a training or get involved in volunteering, things like that. You can find some of that information here. And then under this resources tab, there's information on work sites and faith groups and the LGBTQ community and youth and schools and tons and tons of resources that are specific to different groups. So definitely worth checking out. Live On is also just this week launching its first ever suicide prevention course taught on Instagram. So they're dropping one lesson per day this week. There's going to be 10 lessons, all about 10 minutes or less. So if you want to learn more about suicide prevention and how to help those around you, follow them on Instagram and take their course. And then within our community, we have access to their Live On Utah campaign toolkit, which is really awesome. So this is something that we use regularly at the health department to make sure our messaging lines up with the Live On Utah campaign. Looking at higher risk populations, so making sure that we're sharing accurate data. And then we want to make sure that we're cautious about creating a harmful narrative for high risk groups. So instead of saying someone who is LGBTQ, sorry, let me rephrase this. Oftentimes we think because someone is LGBTQ, they are at higher risk, but it's because of discrimination or feeling isolated from their community that puts them at higher risk. Just being LGBTQ would not necessarily put somebody at risk unless they're feeling that kind of isolation. So we want to make sure that we're just making those shifts in our language so that we're not kind of tying kind of harmful narratives to high risk groups. Sharing group specific protective factors. So there are protective factors in every community that we want to make sure that we're building on. And we can identify those within the community that we're working with and try and help promote those. Again, being clear that it's discrimination rather than identity that can cause increased risk for the LGBTQ community and BIPOC populations. And then making sure that we're using images that are representative and not stereotyping. Sorry, my PowerPoint is struggling. There we go. And then social media. So again, this might be where we maybe have some more interaction with suicide prevention messaging, but making sure that if we are posting something that we're monitoring the comments within the audience that is commenting on it. So if I've posted a picture, something about something and I want to talk about suicide prevention, I want to make sure that I'm following up in the comments and seeing if there are going to be people who are maybe showing warning signs of suicide, and then I can follow up on that. And then if we see other people whose content is unsafe, we want to make sure that we report that. You can do that just on the social media app. There's usually a little button that says report. We can also add resources and education in the comments. So providing, the 988 number, providing other resources, and then also message them directly. So just letting them know that we want to make sure we're promoting safe suicide prevention messaging. And then deleting harmful comments on our posts. Okay, and then looking at stories. So lived experience speakers should be in a safe place in their recovery. So I mentioned this earlier, but we want to have people be at least a year after an attempt or a loss. Just making sure that they've had some time to kind of work through some of that. Sharing their journey with a hopeful tone, describing what's been helpful, and talk about how far they've been able to come in their recovery. Sharing that help is always available, including those resources like the National Suicide Prevention Lifeline. Again, that number is switched to 988. You can still call this number though. If you called 273-8255, that would still connect you in, but 988 is just faster and easier to remember. We don't want to include information about lethal means or the method that was used in their suicide attempt, and then avoid portraying suicide as an option or an acceptable response to life's challenges. So if at some point you are, maybe having a event where someone is sharing their story, just make sure that they are following these safe messaging guidelines. And then there's a handout from the American Foundation of Suicide Prevention that goes through kind of some of this information so that you could share with speakers. And then make sure that you're helping them kind of develop hopeful, actionable talking points in advance so you know what they're going to be talking about. This is a picture of a video of Taryn Hyatt. Maybe some of you have heard of her. She is the director of AFSP in Utah, which is the American Foundation for Suicide Prevention. She is a suicide loss survivor. She lost her dad to suicide. She's also an attempt survivor. And so she shares her story on the Live on Utah YouTube channel and is a great example of how to share your story safely and how to promote that hopefulness. So we're going to look at some messages that we have seen in media, and we want to kind of identify if the message follows safe reporting guidelines. What does the message do well? What could be improved? And overall, is it likely to increase or decrease risk for vulnerable populations? So I want you to just kind of put in the chat as we go through this, try and think of these questions, and we can kind of just talk about the reports that we have seen in the past. Okay, so looking at these two different pamphlets, this first one here, what would maybe be some concerns with the pamphlet on the left? Does anyone have any thoughts? I saw hopeless, no hope. I kind of missed that first comment. It's dark, yeah.
The first one was focuses on the despair.
Thank you. Yes, absolutely. Yeah, we kind of see that imaging. Oh, someone said depressing, where they've got their hand in their heads. There's, that suicide prevention. It almost looks like a little bit of a warning sign. So we have resources on here, and that's a positive thing, right? But it's kind of being disregarded because our imaging isn't super hopeful. Where you can look on this other side, we see a call to action, right? We see the be the one to ask. We see resources on there, and we see two people who are looking at each other, they're connecting. So this would maybe be a better way that we would want to message about this and provide that resource. Okay, what about this one? Minnesota man kills himself in front of coworkers after being fired from his job. What are the issues with this one? Focuses on the violence. Yes. Shows the gun. Absolutely. Yeah. So we kind of see some of that sensational messaging here where it's like we got the story, right? He kills himself in front of coworkers. That is, not going to be a hopeful message that we want to share. It shows a means here. So this could be something that would put somebody maybe at higher risk. And it ties suicide to one thing, right? So he was fired from his job and then he died by suicide. And so that's simple oversimplifying as well. So instead we could have said, work site works to provide support to staff after loss. Something like that could maybe be a different way that we'd message that. Does it have the same, a lot of times coming from people who are in media, they might say, well, that doesn't tell the story that we want to grab people, but that's not the point here. We want to make sure that we're providing hopeful stories and hopeful narratives. And then here's another one where we can see reach out, how to help someone. So there you can see the image is a little bit dark. They could definitely brighten it up a little bit, but they are reaching out, kind of trying to get help. So that's, it's definitely some positive things in this one. And then we're seeing some of those resources. So just as we've kind of talked about this, hopefully this can help us kind of understand the way that our words, our messages, images can impact those around us. So making sure that we're speaking about suicide in a way that promotes hope and healing, reviewing our safety materials or our own materials through a safety lens before we're making anything public. So maybe we've talked about mental health in our work sites or within our friend groups or whatever, but just making sure that if we are sharing materials that we're looking at them through that safety lens. Definitely go back, share this information with your organizations, colleagues, partners, friends. And then we can definitely kindly but assertively help others to improve their communications as well. So this can sometimes feel a little bit awkward, but just saying like, hey, this would actually maybe be a more hopeful message to share, and then providing how to do that. And then continue to learn about suicide prevention. So I've mentioned QPR. I think Sadie maybe put some information about that in the chat. So that's going to be a great resource. Again, that Live On Utah has it's called the Suicide Prevention Playbook, where you can learn lessons on suicide prevention just on Instagram. So those are going to be some really great, easily accessible resources. And then just kind of think about, what changes are you inspired to make after today? And then there is that you can find more about safe messaging on liveonutah.org. Keeping in mind, is our story hurtful or helpful, and making those adjustments. And then I'll kind of just end with this quote. It says, we believe strongly that the issue of suicide is really important to raise the volume on. So it's not that portrayals are all bad, it's the way that it's done, and that it needs to be with a prevention message and a message of hope, something that can inspire others to work through life struggles, whether they're way upstream from actually being in crisis or even when it's at the moment of suicidal crisis. So definitely important that we're doing things about suicide or preventing suicide, but we want to make sure we're just doing it in a safe way. So if you've got a second, you can feel free to pull your camera up and follow this QR code to the training evaluation. It'll just ask you some questions about what you learned today. And then there is my contact information if you have additional questions. If you would like a safe messaging training or QPR training in your organization, I'm definitely happy to help you with that. And we can kind of work with Healthy Lifestyles to do the QPR trainings. So does anybody have any questions or thoughts on anything that we've talked about? And feel free to unmute yourself if you're able, or throw it in the chat.
And while people are putting things in the chat, thank you so much for all of this wonderful messaging. I think that, some of the things that we are used to hearing, especially when it comes to language, just kind of either roll off the tongue, or we don't think too much of how it's playing into the stigma of mental health. So I really appreciate you taking the time to teach us all about that.
Absolutely. Yeah, and it can take a minute to make those shifts. I know for me, it took a minute. I had to really think about the way I talked about suicide when I first started working in suicide prevention. But then when you get kind of used to it, it gets a little easier, but it's definitely a shift.
Oh, yes, definitely. And if this is something that is near and dear to your heart, our Healthy Lifestyles team is actually offering 25 points for going to the Out of the Darkness community walk. It will be at Veterans Memorial Park, which is just by West Jordan City Hall. It's on Saturday, September 10th. From check-in starts at 9, the walk starts at 10. I'll put the registration in the chat box for anybody who's interested in going to that. Have you been to this walk before, Brianne?
I haven't, but I've heard such great things about it, so I'm sad to miss it again.
Yes, I have heard that it is just a spectacular experience. This will be my first time too.
Awesome. Definitely check that out. There will be lots of resources at the walk. There will be some live on materials from Salt Lake County. So make sure you go check out NAMI's table, the National Alliance on Mental Illness. They'll have a bunch of information. Okay, well, if there are no other questions, I'll give you back 15 minutes of your day.
Thank you so much. And we hope all of you have a wonderful day. If you haven't already, please sign in for Healthy Lifestyle Points.